think it's the implications around if we're not effective and the effect it has on our teams. I think the effect it has on patients and families and communities. And, actually, I don't know that how many healthcare leaders really equate what they do to affecting the quality of care that's being delivered as they work with their clinicians. So, for example, we've been helping to work with physicians on trying to reduce their burnout, and the medical record is cited as one of the key causes of that because they're spending more time in the computer and documentation than actually face-to-face talking and communicating with their patient.
Welcome to the Psych and Business Podcast. We're here to show you how practical psychology can be useful and make your workplace better. I'm Dr. Ernest Wayde. Okay, so my guest today is a healthcare executive who has a focus on helping individuals and teams in healthcare mitigate burnout. And as well as we all know, burnout is a real issue in healthcare, especially since COVID came along. His name is Dr. Steve Brewer. Now, Dr. Brewer is the Chief Operating Officer for GI Associates, an independent medical practice with 5 locations throughout North Central Wisconsin. And in full transparency, Dr. Brewer also works with my wife, Dr. Melinda Wayde. Now, Steve has over 30 years of healthcare leadership experience working with a variety of organizations, including private practices, hospital systems, and academic systems. Steve, welcome to the show.
Thank you. Nice to be here.
Steve, I really want to talk about your experience, especially your focus on burnout in the healthcare industry. But before that, I always want to start. Tell us a little bit about your journey and how you ended up doing this kind of work and this research.
Yeah, I appreciate that. And again, thanks for having me on. So I started, as you mentioned, in healthcare 30 plus years ago. I started in cardiac rehab, worked in physical therapy departments. My undergraduate degree is in exercise science from many, many years ago, and just continued to evolve in the healthcare space. And when eventually took an administrative track, went on, got my master's in business administration, worked for independent medical groups and health systems, just a variety of different roles, and had a lot of different experiences along the way. Some good, some not so good. And then also this last few years, or 5 years ago, 6 years ago, went back to school as a lifelong learner and finished my doctorate in health sciences with an emphasis in leadership and organization behavior. And that's where, even prior to that, I started doing research on mitigating burnout and getting back to core values and pursuing passions and that sort of thing back both personally and professionally. But then I concentrated my doctoral research on leadership burnout and mitigating strategies and building into engagement.
Yeah, that's such an interesting and winding experience that led you here. I always say, the straight path. There's never a straight path that gets people where they are, right? It's always an interesting winding path, but it's always full of interesting experiences. I want to ask you about your research, especially when it comes to leadership burnout, because I can understand clinician burnout. Talk to us about
Mm-hmm.
why leadership burnout is something that's so important and how that happens.
Yeah, so great question. And I think it's one of the things I'm seeing it in the literature a little bit more and acknowledging. But years ago, 5, 6, 7 years ago, when I started kind of looking into this, you didn't really hear much about, healthcare executive leadership. A lot of the focus is on probably physician leadership as a epidemic
Right.
and just folks really looking to leave the field after so many years of study and dedication, but just getting overwhelmed with all the different things that take them away from why they went into medicine in the first place. And then you start to hear more about other clinicians, nurses, advanced practitioners, even in different disciplines in terms of physical therapists and others. Just there's just so overwhelming. There's always just seems to be this continued pressure to do more with less. And then as we get into administrative tasks for billing and coding and documentation and productivity, let alone all the staffing shortages, it just seems to be piling on and piling on. But then, as a healthcare executive, there's a lot of folks that have gone into healthcare leadership with that same passion. They want to help patients, they want to help their communities, and feeling some of the same stresses and struggles. And it's that classic, I'm just not able to do what I think I need to do for my teams and my patients and the communities. And that then starts the way, very similar to clinicians. And MGMA, Medical Group Management Association, a couple of years ago did a stat poll, and 80% of the respondents from around the country of healthcare leaders, medical group leaders, responded to either heightened senses of feelings of burnout or stress, and really kind of help call attention to that, as well as some other research that's out there. So, and there's a lot of uh, struggles in the leadership ranks, both clinician leadership, but also administrative leadership. So it's starting to be, I think, talked about more, and hopefully we can kind of join arms and look at mitigating that together.
Yeah, I think that's such a really important thing, especially when we talk about leadership. It's not just about the clinicians; it's also about the administrative leadership and that the role that they play in the success of healthcare overall. I think that's really important to be focusing on leaders and burnout. I know you've done some research in this area. How do you recognize this? How do you identify burnout in the leader, and what can you do to mitigate that?
Well, it's I even equate it to the what's the adage with the boiling frog? All of a sudden, you put them in a pot of water and turn up the heat, and they don't realize they're starting to overheat. And
Yeah.
burnout can be the same thing. You go in, you pick up one struggle, you find a solution, you move on to the next, and it can kind of seep in slowly. It's not necessarily an acute episode that all of a sudden, boom, you wake up tomorrow and you're burned out. It's one of those things that kind of sets in gradually. But it's the typical kind of things. The higher senses of feeling exhaustion or fatigue, uh, growing senses of frustration, cynicism, feeling less passionate about work. It also starts to manifest itself in terms of physical ailments, sleep disturbances. This term of maladaptive behaviors are things that, like, hey, I'm eating too much. I'm starting to use alcohol or other things to kind of help kind of get that relaxation or things happening. And all of a sudden, people kind of go, yeah, wait a minute, how did I get here? And so part of that is recognizing the signs and symptoms early to avoid that downward spiral.
Yeah, I appreciate that. Those symptoms are very similar to what other leaders experience and what other people really generally experience in burnout. What do you think is unique about healthcare leadership? I've worked in healthcare a lot myself. What do you and you I know you have. What do you think is unique about healthcare leadership?
Um, I think it's the implications around if we're not effective and the effect it has on our teams. I think the effect it has on patients and families and communities. And actually, I don't sure though that how many healthcare leaders really equate what they do to affecting the quality of care that's being delivered as they work with their clinicians. So, for example, we've been helping to work with physicians on trying to reduce their burnout, and the medical record is cited as one of the key causes of that because they're
Hmm.
spending more time in the computer and documentation than actually face to face talking and communicating with their patients. And then there's a lot of off patient facing time, evenings, weekends, where they're doing documentation and trying
Hmm.
to get things so we can, get the right uh, diagnosis codes, the complications and things, and also the documentation needed for correct billing and collections. So all of this kind of adds weight and pressure to the clinician. And as leaders, being almost feeling like that rock in a hard place, we would like to help and reduce that, but the increasing burden with regulations. Oftentimes, if you're in a large health system, it's hard to get the resources that you need at the time that you need them.
Hmm.
And it's just that kind of, clinicians have used the word, that moral injury, but, healthcare leaders can feel that too. And they want to give their best. They want to help those that they're there to serve, and they can't, and for a variety of reasons. And so I think that's maybe adds to the burnout in healthcare and then
Hmm.
particularly
Hmm.
in leadership. Healthcare is endemic in other fields, obviously, as well. But I think there's that added element of the implications on outcomes and actually delivering care and improving lives for patients.
Yeah, I think that makes perfect sense. Especially, I remember working in the healthcare industry, being a leader in that industry, where you worry about your decisions that you make and the ultimate impact on patient outcome. Right, we're talking about patients' healthcare and their lives, and so I think that's such an additional burden, as you said, that leaders have to face in the healthcare industry.
Yes, and then, and as it's tragic almost. As some I've worked with a couple of physicians that come to mind, that they were on the fringe of retiring or leaving the field early, and by pausing and having a just a genuine conversation with them on what's happening with them personally, that's prompting that thought process, that consideration, and just being able to actually reach out and help, and actually, that preserves, in both cases, help preserve the clinician. They changed their practice direction a bit, but they stayed as a practicing physician, and so the community is better off, I know, because those doctors are still seeing patients and helping people. Where had we not paused and had that conversation and looked at what was driving their levels of burnout, the community would have lost some really key and great physicians.
Yeah, I think that's such a great adjustment that you can make to help the physician continue to practice. I know. Speaking of practice, that you're in private practice at GI Associates, and you've come in there as the COO after the organization has had a COO for a really long time. Talk to us a little bit about your approach when you come into a situation like that in terms of managing change for the organization and the people in the organization.
Yeah, I think it's very similar to a lot of, I was going to say management, but maybe just good, authentic, genuine leadership. Of one is just start to understand. Is that old adage of seek to understand before being understood. And the other is people aren't as concerned about knowing about what you know as much as is how you show that you care about them, and the right values and things. So part of it is just kind of getting to know people, getting to know the processes, getting to understand things, and then start to kind of, that humble inquiry, ask questions around, well, how do we do things? And why do we do it this way? And some things are more glaring than others as we have to continue to evolve with an organization. And when you've had long-standing leadership and traditional leadership, it's easy to go, well, I'm not sure. We've done this way all along. And so it's time to, maybe now that you ask the question, maybe there are ways that we can
Hmm.
help streamline processes. Right now, coming into the throes with where technology is going with artificial intelligence and how that can be used to help supplement the clinician's work, but also kind of the back office work with revenue cycle and patient reception and scheduling. It's just that healthcare as a field is extremely dynamic, and so as a existing or even a onboarding leader is helping people see that and adapt and transform. Because if you're sitting still in healthcare, you're going to be quickly left behind, and so that's just kind of engendering that. What are the common things that we need to be working together as a group team, and
Hmm.
also what are those value and cultural things that we need to preserve?
Yeah, yeah. Talking about healthcare and how healthcare is changing and adapting, especially with the influence of technology. Yeah, I'm wondering what are your thoughts on how do leaders, especially in this time, manage burnout when there's so much going on, and also manage change when there's so much change going on at the same time. How can leaders try to balance those things out to try to remain healthy in these environments?
Yeah, one of the things that I would definitely propose for the leader themselves. One of the things is pausing, because there's so much external focus. Like, we need to help our teams, we need to focus on patients. What's everything happening external to us, and that's also feeds into that kind of that slow progression into the deeper levels of burnout. Is pausing and giving ourselves permission to actually, it's okay to do self care and to take care of ourselves and have that balance ourselves. And that's the saying of, you can't pour from an empty cup, and it's okay to put your oxygen mask on.
Yeah, first.
Because I know, it's when I was having struggles, or different parts of my career, and looking back, one, I didn't really necessarily realize where I was at, in terms of struggling with trying to, stay motivated and that sort of thing. But also realizing I wasn't doing so great for my team. I always putting in super long hours, the weekends, sacrificing family time and leisure time. Over time, that created the classic symptoms: exhaustion, difficulties with the relationships, cynicism, etc. And looking back, I'm like, I wasn't really doing the best for my team because I also wasn't doing things for my own well-being. And so I think that's probably something to pause and reflect on, because it's too easy to keep trying to take on the weight of the organization and the change. And then actually, ironically, that helps as you can kind of relax and as a leader and kind of refocus. That enables you to get others to be more calm, relax, refocus, and not get too spun up as well.
Yeah, that's such an interesting concept, to focus on yourself in order to be able to help others. Especially I think sometimes leaders think that they just have to keep pouring out from themselves to help and focus on
Mm-hmm.
others, but it's really important, as you're saying, to be psychologically minded and understand that when you're healthy, then you can help other people be healthy. Now that brings me to what I wanted to ask you about next, Steve, because I know you have a focus on positive psychology in your work and in your approach. Tell us a little bit about that and how you weave that into the work that you do.
Yes, in my studies, I've come across the whole notion of positive psychology and where that's at in terms of the key tenets. And I kind of go back to one of the core models called the PERMA theory, or model, if you will. So it's positive emotions, engagement, supportive relationships, having meaning and accomplishments. So PERMA, and then inviting people to kind of take a step back and reset. What drives our purpose? What gives us joy? What gives us that meaning that when we wake up in the morning, we're excited to go to work. We're excited to do, whatever that task is. And in some respects get back to that and just kind of adopt that behavior or that mindset, if you will. And then there's also techniques working backwards from that. What are the things that are getting in the way from that? And inviting those conversations on, what can we do to, refocus, whether it be the workflow or resources or support, or frankly, even just talking about it. I'm feeling frazzled, and it's okay to acknowledge that, and then we can kind of support each other. And I think that's another key point of going past a little bit of what I tend to see in some, resiliency, webinars and conferences and things, is having a little bit too much of kind of like, well, get some sleep, eat better, take some rest, maybe do some yoga or something like that. Well, I think all those things are important for overall well-being, but we also have to construct a good work environment and give people the resources, give people a chance to have a voice, have some influence in where things are going. And all of those are embedded within the positive psychology models that are out there. And also acknowledging, as it's easy to kind of get caught up in negativity, and people start to spiral down that negative, spiral into hopelessness and frustration. But the opposite is true. One of the key models or theories that I came across in my studies was this whole thing about the broaden and build theory by Barbara Fredrickson, well-known psychologist in the field of positive psychology. Is as we pause and we allow ourselves to have some positive experiences, it actually has been shown that it opens our minds to other innovative thinking, problem solutions, and that builds connections and resources, and it just kind of starts this upward spiral, they call it, as it relates to the broaden and build. So it's broaden your mind, open yourself up, and build resources and things. And so that's kind of a nice framework, I think, to kind of counter that negative spiral that we can almost naturally get into as people, because our brains are kind of wired towards more the negativity versus the positivity. And how do we consciously recalibrate some of our own neuroscience connections to be more biased towards the positive than the negative. So a lot of deep stuff there, but those are the things that I think are interwoven in all of that.
Yeah, I appreciate that connection between psychology and neuroscience. I think all of these things are related, and so I really appreciate the starting to think positive. Can help you be more open minded, which can lead some positive action and positive behaviors. It reminds me of that cycle where your thoughts impact your emotions, impact your behaviors, and that cycle of thinking and behaving and action. So I think that's really important to interrupt that somewhere. Where do you recommend if a healthcare leader has concerns about burnout or starting to feel some of that those symptoms, cynicism, and things like that? Where should they start? What's a good place for them to start?
Well, there's a couple of web pages I would maybe direct them to. There's one is the University of Pennsylvania, where one of the leading psychologists in positive psychology started, Dr. Martin Seligman, I believe. They have a whole host of web pages. If you just Google that, UPenn Positive Psychology. And then also UC Berkeley has the Greater Good Science Center. It's same thing. It's great resources. It's built for people who aren't necessarily in the psychology field that they can kind of relate to and put things in context. So that's one area, or a couple of areas I would recommend if they're interested in doing some a Google search and find some immediate tips and techniques and models that are there. The other thing I would encourage, and I don't put myself out as a big mindfulness guru, but looking into actually doing some mindfulness meditations and other things, because I think if we don't learn to quiet our minds and understand our emotions, that's really foundational as we open up our minds to some of this other, these other things in terms of understanding what drives some of our own, emotional and physiological reactions, what gets us upset, and how do we then acknowledge it early so we don't continue to let that spiral. So those would be a technique and maybe a couple of web pages people can search.
Yeah, I think that's so helpful, Steve. Especially, I'm a big fan of the mindfulness approach, especially helping to understand, who you are and how what's impacting how the way you're feeling and the way that you're behaving. I think that's all very, very important when it comes to being effective. Now, I want to tap on your experience here a little bit because you've had great experience in private practice as well as large healthcare organizations. Where do you see healthcare going, and how can leaders really start to prepare themselves and their organization for the future as you see it?
Yes, I think it's a great question. I think one of the reasons that or maybe I should maybe background. When I first started in healthcare, I was with an independent medical groups, and so it was the classic. We were local. We could make our own decisions. You had an immediate influence. As you get into larger health systems, as a leader, you start to get diluted away from that because there's different approval points, there's different layers and communications and things. And so what used to be a 5 minute decision could be a 5 month decision or sometimes longer. And so, but that's just kind of the nature of the beast with healthcare environments these days. So part of it is one, going into it with expectations or understandings. Yep, that's kind of how that works or can work. And I think these other techniques and things help keep things in perspective. So it's not as, for those like myself who've had that previous experience, it can be very challenging to accept, what do you mean I can't make these decisions anymore as a leader? To more of that inclusive and or they call it the matrix layering component. But there's ways to still engage and lean in and make a difference. As part of it, again, it kind of goes back to mindset. And so just kind of knowing where those environments are and also what are your strengths and where do you thrive? And also not losing sight of your core authentic self as you kind of navigate those things. I think those things are so key that can help transcend almost any environment. And
Hmm.
not that every environment's ever going to be necessarily perfect, but as healthcare and the complexities and those different pressures continue, I remember I've been doing this for a number of years, and it could have been 30 years ago. Oh, we have to do more with less. That mantra was there 30 years ago. It's here today. I think the magnitude of the volume of things we need to consider with technological advances and everything else is higher, so there's more to adapt to. But I think all the more reason to kind of take a step back and kind of calm and walk through things more purposefully and not getting too caught up in the fray. So very long-winded answer, but those would be some words of advice to folks as they continue their journey into healthcare leadership.
Yeah, no, I appreciate that, Steve. I think it's, healthcare is a changing field constantly and continuously, and I think there's just a lot with all the big healthcare organizations buying up a lot of the small ones, and a lot of leaders are having to face challenges and do things differently than what they'd have to do. So I appreciate your insights on that, Steve. This has been such a great conversation. How do people contact you if they want to continue the conversation or have questions for you?
Yeah, actually, I'd love to hear from folks. If anybody wants to send me an email, it's steve.brewer, Brewer, at giassoc.org. Or they
Awesome.
can Google GI Associates and give me a call there in Wausau,
Fantastic.
Wisconsin.
And I always want to take advantage of the experts that we have on the show, like yourself, and ask, what's a tip or a recommendation that you have for leaders and organizations, especially in this time frame that we're all in right now?
Well, I think I'll go back to staying centered on that motivator for you. That
Hmm.
don't lose sight of that meaning and purpose that you have that brought you into healthcare in the first place. A lot of the things that we're dealing with, as long as we're sharing and opening up, there's a lot more good out there than what might feel on day to day when these pressures kind of mount up, and perhaps not lose sight of what brings you joy. And I think if you can do that, some of these other things won't feel so daunting.
Yeah, I love that. Don't lose sight of what brings you joy, right? I mean, what brought you into the field in the first place? Focus on that. Be centered right on that. Steve, thank you so much for coming on the show. It's been a real pleasure having you on.
Thank you so much. It was very enjoyable. Thank you.
Excellent. And if you've enjoyed the show, please consider subscribing and leaving us a review. Feedback is a gift, and we love gifts. Thanks for listening. We hope you will join us again next time.